Hey everybody, welcome back. Today we're doing a How Stuff Works Decongestants and Nasal and Sinus Pressure Care. Now the first thing to remember any time of year, whether it's spring, whether it's allergy season, whether it's winter colds, whether it's fall as the leaves start to decay, is to always make sure you're doing your neti pot year round. If you haven't gotten one of these yet, please check out my video Neti Pots 101, keeping it simple, learning the basics, and making sure that you take the best care of your sinuses all year round. However, if you do find that you're starting to suffer from some notable congestion, please remember that it's critical you take care of the sinus congestion right away, because anything that's up here, mucus-wise, ends up down here. Mucus-wise. That means your lungs will start to fight an upper respiratory, lower respiratory infection that can get quite serious pretty quickly. So if you can stop it before it starts to descend through your respiratory system, you have a much better chance of having a much better winter or spring or fall, whatever time of year. Now I'm going to show you a couple products that might have you wondering what the heck you should be using and when, and this is why we're doing a How Stuff Works on these today. The three items I have are all about nasal and sinus congestion, so let's get started. The first and most traditional remedy many of us have seen is a simple nasal decongestant pill. This is something like I don't know, Sudafed or Sudafed PE as it's now called, the kind that doesn't have the pseudoephedrine in it. This is a simple and small pill that's typically taken every 4 hours, and it allows for a decongestion in the nasal passages. Very small pills here, and only one every 4 hours required. In just a second we'll talk about what it means to take these and how your body responds. The second product I have is a nasal spray. This is a 12-hour nasal spray, which means that you only have to use it once in the morning and once at night. And the last item is a Nyquil type product. This is a non-name brand. It's a cold and flu product, one kind for daytime, one kind for nighttime, so that you can sleep. Now what I want to talk about today is what each of these does so that you can anticipate the effects. Let's go to the nasal decongestant pill first. First thing you want to know about nasal decongestant pills is they almost always cause sleeplessness. These items are guaranteed to get you revving, get you going, but what that means is if you take it at 8 o'clock at night and you're sensitive to products like this, you could end up staying awake all night long. It can also cause you to be very jittery during the day. So also be aware that this kind of a pill having to be taken every 4 hours means that you have to be able to keep your eye on the clock, you have to have water nearby. Depending on the kind of job you have, that may or may not be possible. The number one thing I want you to know about these pills for today's discussion is that they will dry you out all throughout the body. They don't just dry out your sinuses. A pill like this that is a systemic pill cannot just target one area. You're going to feel your mouth get drier. I will often wake up coughing, a dry, choking cough at night if I use these. You'll notice your skin is drier. You'll notice you're thirsty all the time. That's what nasal decongestant pills do. Be aware that that can be the effect. The second item that we're going to look at again is the nasal spray. Now what I have here is a product based on Afrin. It's called Anafrin. It's a non-name brand, and this is very specifically two things. Other than 12-hour, it is extra moisturizing and no drip. What that means is when I spray it, it's not going to run down the back of my throat and burn like acid all the way to my toes. Also, extra moisturizing means that it's not going to make me feel like the Sahara inside my sinuses. How do they do it? I don't know. But if you do use nasal spray, make sure you get the extra moisturizing and try to get the non-drip. Yes, it's more expensive. Yes, it's worth it. This product only needs to be used every 12 hours, and that's one of the bonuses and advantages of it. You don't need water. So again, depending on your work life or your general daily life, this can be a nice alternative to something you have to take as a pill. The last item we're going to look at again, the Nyquil, essentially Dayquil pack. I'm looking at the Dayquil kind because we're talking about stuff you'd use during the day. These pills are significantly larger, so if you're dealing with something that has your throat swollen, this could be an issue for swallowing. Let me compare it here for you a minute to the little tiny decongestant pills we had in the beginning. We've got the large Nyquil caps over here, and we've got the tiny little decongestants. You would take one of these every 4 hours. You would take 2 of these every 6 hours. The nice thing about Nyquil is that it allows you to stay awake. It's energizing without being overwhelming. This one doesn't have me feeling like I'm on speed quite the same way the traditional old school decongestant pills will. These will dry you out, similar to this guy, but not in quite as extreme a way. Now, everybody's got their own preference. Everybody's got whatever they think they need to use personally, but I'm just going to tell you straight up that as I've been working with my lungs with asthma over the years, I opt for the nasal spray. Why? I only take it once a day and once at night. It absolutely positively cuts down anything that could end up dripping into my lungs and causing a serious asthmatic issue. It also is not a pill. I'm already taking tons of pills when I'm sick. Everything from echinacea to vitamin D and B to something for the mucus like Mucinex. I really appreciate not having to take another pill, but the most important reason I use this, it doesn't dry out my entire system. This is not a systemic pill. This guy goes straight to my sinuses. It only works here. It doesn't influence my digestion. It doesn't mess up any kind of speed. None of that happens for me with this. So for me, this is the answer. For you, it might be this guy every 6 hours. For you, it might be this guy every 4 hours. But please just be aware, you do have options. So anytime you're feeling a little bit like this, you don't have to feel like this forever. There's something out there that can work for you. Thanks for joining us. Please share with a friend. I'll look forward to seeing you next time.